Good afternoon, and thanks everybody again for attending the webinar today. Really just to start and lay the groundwork, cybersecurity and more specifically security awareness training in the healthcare sector is a critically important and I think very relevant topic for security professionals today. With the continued rise in ransomware attacks and the focus of hackers specifically on the healthcare sector. I'm Harvey Morrison, the Chief Revenue Officer for CybeReady, and I'm really lucky and glad to be joined today by Patryk with Medicover, who will be able to provide us with actual healthcare industry insights as to what's going on. Excuse me, Patryk, maybe you can take a minute and introduce yourself and Medicover to our attendees today.
Thank you very much, Harvey. Good afternoon, everyone. And it's my pleasure to be here today. And once more time, thank you, CybeReady team, for inviting me to share some insights, my insights about the awareness, cybersecurity awareness. I've been working in cybersecurity sector for more than 10 years. In Medicover, I'm responsible for the corporate data protection. So I'm on the corporate level, on the group level. And also I am responsible for building the awareness program and building all the, let's say, training campaigns that we have in Medicover. Some facts and figures about Medicover. So we are one of the biggest private healthcare services provider in Poland. We're not only we do not only operate in Poland, but we are a multinational company. We're in Romania, in Germany, for example, in Balkan countries. We're also in India. We have like 50 hospitals, more than 200 clinics. So we're quite a large healthcare provider group.
That's great. Thanks very much, Patryk. And I know with your role there and the things that you do, you're right on the front lines of dealing with hackers and ransomware. So really look forward to your insights today. So we'll dive in here. But as I mentioned at the start of the webinar, cybersecurity and more specifically security awareness training is an extremely relevant topic for the healthcare markets. And the reason for this, as the slide states, the healthcare industry has become one of the most targeted sectors for cybersecurity or for cyber attacks. Here's some quick industry statistics. Over the last year, cyber attacks on healthcare companies has risen by 128%, with the vast majority of these attacks being ransomware. One of the most high-profile attacks this year that I'm sure everyone in the space has seen was United Health, which reported being attacked, and as a result of this compromise, 100 million individuals lost their personal information. That's one of the largest healthcare data breaches in U.S. history. Patryk, with this, I'm just kind of curious as to what maybe you're seeing at Medicover, and then maybe more generally what you're hearing across the healthcare industry.
Yeah, so definitely, it's true that the number of cyber attacks where the healthcare providers are targeted is growing, and it's growing very rapidly. We can see it in Poland, we can see it in other countries as well, that we are targeted more and more, especially when the war started in Ukraine. We also can see that the number of let's say, fraudulent and connections from our eastern border is growing up. So we can see it. We can see it also by statistics. So, for example, in Poland, the number of the breaches that were notified to the data protection authorities constantly growing, and there are more and more healthcare providers, healthcare units that also notify the breaches. And what is even more important, I believe, great amount of these breaches that are notified and the cyber attacks that are committed is because of the trigger of the attack is many times phishing and ransomware attack. So yeah, we can see it, and I really think that some kind of I would say hackers ethic, if we can say so, has changed. So we can see that some time ago, hackers didn't tend to attack healthcare providers because this can interrupt providing some services that can save your life. So they were aware of it. But right now, only what matters is money. So there is no more something like ethics in there when it comes to hackers. And they know that in some of the countries, like in this part of Europe where I came from, there are, because of many reasons, there are some issues still that have to be addressed when it comes to cyber security level, and hackers know it. And what is even more important, than they know the value that regarding the data that we process. That's why the healthcare sector is more and more targeted, I believe.
Yeah, that's a really interesting insight you have there around the ethics, if you will, of hackers. And the fact is, hey, we're now just interested in money. We don't care the industry that it's at. And so that really kind of leads into, I think, the next slide here, which is, we highlight for healthcare organizations really the consequences of a successful ransomware attack on these companies can be very devastating. And there's a few things to think about, right? I know that the top of mind comes just the cost of the ransomware itself, which is continuing to increase. According to an article in the Financial Times earlier this month, they're saying healthcare organizations are reporting an average ransomware payment of up to $2 million, which is up 500% from 2023. But then you kind of put on top of that, or layer on top of that, the theft of the business information. So organizations are starting to deal with, and I've heard this come up more and more, Patryk, is what they're calling this double ransom, where, hey, we're going to encrypt your data, and if you want access to that again, you pay us $2 million. Oh, and now we've stolen your data, and if you want to keep your data off the dark web, you now have to pay us yet another ransom. So the theft of that business information. And then there's the compromise of the patient data, which not only, I think, hurts the reputation of the organization, but then there's also, as you mentioned earlier, Patryk, all the regulatory agencies and regulations around it, where now you're going to have to start to pay fines, from a PHI and a HIPAA and those sorts of things. And that can be, I've heard, anywhere from $500 to $10,000 per record. There's a couple of examples here in the US where, like, Northwest Memorial Healthcare had to pay a $9 million lawsuit against them that was brought because, hey, you lost my personal information. So, when you think about the money that's going to cost, just the ransomware demands is kind of the tip of the iceberg. And then you mentioned, Patryk, the service disruptions, right? So in the healthcare space, not being able to provide service can really be a life and death sort of consequence. So again, Patryk, love your perspective on kind of all of these consequences that healthcare organizations need to be thinking about. Yeah, if you don't mind, Patryk, maybe give us just some insight on what you think about those.
Okay, guys, sorry. Yeah, definitely we have to remember that when you negotiate with the hackers, you can't trust them. They're criminals. So if they wanted to hack you, if they wanted to break the law, nothing can stop them to let's say hack you one more time, and to even to don't log your data, to don't provide you with the access to your data. That's the first thing. And the second thing, of course, the regulatory or the compliance that we have to meet as healthcare professionals. We have to remember that we are responsible not only for regular personal data, we're responsible for sensitive personal data. It's not only regarding the GDPR and all applicable data privacy regulations that we have, but we have to remember that we have to keep so-called medical secrecy regarding our data. So all of this leads us to some thought that I really believe healthcare providers have to care about the data of their patient more than the other part of the, let's say, regular markets that do not have so sensitive data about their clients.
Yeah, no, that's a great point as you think about it. You have your business intellectual property, which can be stolen, but in the healthcare space, you overlay that with all the PHI and PII data that you are now responsible for. So that just increases, I think, the regulation, and to your point, the area of responsibility that
And this
healthcare
also,
organizations
sorry,
have.
this also increase and this also have impact on some fines that will be issued after the breach, because when you have so sensitive data, I'm more than sure that when it comes to the some calculations for the data protection authorities, what the fine should be, they really take into consideration the type of data that was
Yep.
accessed, that was stolen, that was breached. So we have to keep in mind.
Yeah, so from a fine perspective, the most valuable data is personal data,
Yeah,
according to regulators, is what it sounds like.
yeah.
So from a security awareness training perspective, which is what we want to shift gears and talk about here, one of the real challenges healthcare organizations are facing is that despite years of training employees, um, employee risk is still really high, right? Industry studies have shown that as many as 1 in 7, even after being trained, fall for phishing attacks, with the vast majority, as we've discussed earlier, of these attacks being ransomware attacks. Effective security awareness training programs, we feel at CyberReady, and I know Patryk, you do as well, based upon all of our conversations, really needs to be a top priority for healthcare industries. At CyberReady, we believe the reason for the lack of effectiveness in security awareness training solutions today can be directly tied to lack of employee engagement and growing indifference to these programs. And I always give this example, and I'm sure you've seen it. Is hey, I'm an employee. I've clicked on a phishing link or a training link accidentally. I've been told, hey, go to this website, sign up for training, and then a week later, I take a 30-minute course. And while that course is running, in the background, I am doing a to-do list, typing an email, a multitude of other tasks, everything but really kind of focus on this
Mm.
training. And so with that, what we're seeing is, or what we think is, in order to change the trajectory of these trends of the 1 in 7. I mean, if you think about an organization of 50,000 people, 1 in 7 is a lot of people that are at risk there. Um, Organizations must change their training approach and focus on providing what we think is consistent and mostly important engaged training. So, Patryk, I know you've been in the space, you've seen different security awareness training programs that are out there, but your thoughts on the role that engagement plays in effective employee training programs.
Yeah, thank you, Harvey. So I totally agree with the statement that it's not like we do not train our people. It's not like we do not provide them with the content, with some awareness communication, and so on. It's matter how we do it, and it's matter how it affects our people. And the great example is that mostly our companies, because of many things, resources, because of money, because of time, and so on, can't afford, spending so much time on thinking about the awareness content, how it should be sent, to whom it should be sent, when it should be sent, and so on, and so on, and so on. That's why if we provide some awareness content to our people, we don't do this regularly. And I think this is the first reason why we do not engage our people. And the second one, I think even more important, is the content itself, because what does not work? Presentations and long articles. So of course it's important to provide also some, advanced knowledge, some more insights, but on the regular basis, on day-to-day basis, what should be the fundament for your awareness campaign should be something that can be checked easily, that can be checked quickly, because we have to remember that especially here in healthcare industry, uh, we are lack of resources. That's where our people, especially medical staff, are busy as they have to run from one patient to another, from one cabinet to another, so they really don't have time to check long articles, to try to understand what are the most important facts from the article. So that's why we should think about, not only when we provide the awareness content, but about the awareness content itself as well.
Yeah, so it sounds like it's more than just, hey, we provide, the content. It's really around how that content is delivered to the employee that makes it impactful, and then sort of how that content is packaged. It can't be in a long PowerPoint presentation or a 5-page article. It's
Yeah,
got to be very impactful. And I think, I pulled this next slide up here, and I think that goes to your point that, healthcare professionals really do work in a unique environment, right? Different from a financial institution, from an insurance company or a government office, in that, they have a high pressure environment. They're working shifts. They're
yeah.
trying to work the training in while they're doing those shifts. To your point, limited resources. So yeah, I think it really is a very unique environment there.
Uh, uh, if I can add something to this, I also think that very important challenge that we have as cybersecurity guys, that have to somehow teach our staff how to, about the resilience, how to detect the threats and so on. Uh, I think that the challenge is that we do not have tools, we do not have ideas how we should measure our warning effectiveness, our warning content, our warning program effectiveness, because you know how you can ensure that when you provide, even if you provide really good communication program to your, based on your, for example, corporate intranet, to your employees, with really nice content and so on, how you can ensure that they understood what is written there, how you can ensure that, or how you can measure the connection between this content that you provided and the way how people react, the way how people detect phishing, and so on. I really think that this is also an issue.
I can't agree with you more on that piece of it, because you're correct. If I just put on our corporate intranet a PowerPoint slide that says, here are our rules around cybersecurity, you need to read them, and we expect that they read it and they comprehend it, and we're going to base our total reduction in risk exposure on that with no feedback at all. Yeah, I think that's a really good point that you bring up. There is, there needs to be a way to not only make sure the content's impactful and make sure it gets delivered, but to your point, being able to measure
Yeah.
and understand that, hey, yeah, I didn't just log in and download a slide. I actually was able to demonstrate that I got the point and understand it, is really I think a critical piece there. So let me just kind of slide in here to talk about sort of current market solutions or current solutions that are out there. And at CyberReady, we think the overall design and how current security awareness solutions are delivering training today really is a reason why there's reduced employee engagement, right? And I think some of these things Patryk, follow along with what our conversation has been up to this point. But one, it's focused on content and not necessarily learning, right? So there are programs out there that say we have 500 courses, and that's great. You can deliver 500 PowerPoint slides,
Yeah.
but to your point, did they really learn from those slides? And I know there's an emphasis that's placed on, well, at the end we gave them a test, but we all know those tests are pretty easy, and you get like 5 chances to pass them. So if you can't pass the test, that doesn't mean you've learned anything, right? I think
Yeah.
learning needs to be done in the flow of work and in real life scenarios that are there. I think the other thing is, security awareness training is not a one size fits all. I think instead the training needs to be tailored to an employee's maturity level from a cyber perspective, as well as their role in the organization. And then to your point there, Patryk, I think truly impactful cyber training, in order to really get truly impactful cyber training, you have to get feedback from that employee and how they're doing on a regular basis, and use that feedback to continually update the cyber training that you're providing. It can't be static, right? And it can't be, a one size sort of fits all.
Yeah.
And so, CyberReady is an innovative security awareness training platform really designed to address this issue of employee engagement and provide effective security awareness training that has been shown to improve overall employee resilience. And also, we like to talk about readiness, not necessarily awareness, because I think everybody's aware that there are cyber attacks and cyber people are trying to phish you. But are you truly ready to be able to combat those things when they come in? So that's really what we like to focus on at CyberReady. And so we talk about what makes us different, right? We take really a continuous approach to training. So it's the platform is designed using machine learning and automation to enable organizations to train their employees monthly or more frequently if required. Because we found, and studies have shown, that consistent and continuous training by far generates the best results. The next two categories, I think, in this slide really work hand in hand with the lean content and the just-in-time learning. I think, Patryk, that goes back to the conversation we had earlier around, you can't just give somebody a PowerPoint slide and expect them to learn
Yeah.
it, right? You've got to give them small bites that are
Yeah.
delivered like, hey, I've clicked on this link. I need right then and there to be able to be trained through a small, impactful note that says, hey, you clicked on this link. You should not have clicked on this link. Here's an example why. I think that's really where impactful training comes in. And then, the last two we've kind of talked about too, which is feedback and data analytics from employees. So if I click on this link and I fall for this, then my training needs to be adjusted to make sure I'm continually tested on this until I learn, hey, I shouldn't click on this link. If I don't click on that link, don't send me another one just like it. Move on to something else and continually take that feedback to update the training and make it tailored and more impactful to that end user. And I know, Patryk, you're overtraining there at Medicover from a corporate perspective. Maybe you can give me some of your thoughts and insights on this.
Of course. Yeah, I would like in particular to follow up on two things. So the frequency, the first thing, and the second thing, the content itself, because the frequency, what you said, I totally agree that it should be adjusted to the individual, to the user, because for me, one time per year to have some training, maybe it is enough, or to have it one per month to get one per month to get one awareness byte per month. But for on the other hand, for someone else who is the new in the organization, or has needs some more time to understand some things, maybe such a person needs to have not one one mail per month, but maybe such a person needs to have more trainings And this is what I like in CyberReady, because in CyberReady I have my employees divided into some, let's say, risk groups. So I have people that present some kind of high risks, that tend to click more on phishing, that tends to has, let's say, lower score in our quizzes. So that's clear signal for me as a cybersecurity responsible person, that I should do something. I should reach those people. I should engage them more. I should, for example, provide additional internal communication with explaining why we are doing it, and so on and so on. And the second thing is the content itself. We as the cybersecurity guys, mostly, of course, mostly, not everyone, but mostly we do not have marketing background, so we do not know how to do something, fancy, how to do a sexy content that can reach your people. We know what should be done, but not exactly how it should be presented to people. And that's why I really like CyberReady, because it's something that is ready to be used, that it's something that is done in a way that I can use it. This is something that is done, I mean, the content, it is not, regular mail full of text, which, frighten people. It's nice content with good pictures that shows what the content is about, and so on. So I really I really wanted to follow up on those things, because I really find them as one of the most important with building your effective awareness campaign.
Yeah, no, I agree with you 100%. We spend a lot of time here at CyberReady making sure and have experts that make sure the content that we're creating is very impactful for the and effective from a training perspective and a learning perspective for those users. One of the things we talk a lot about is our background as a company comes from training, right? So a lot of folks come at it from a cyber perspective and then try to get into training. Our founders, one was pretty much cyber focused, the other was 100% training focused. So I think that really gives us some unique capabilities. If you look at the platform and sort of what comes in the platform, I won't dive into great details on all of these, but there are a couple I want to highlight and just talk to you about them, Patryk. One, the core to the platform is our phishing and smishing capability. So we've added the ability to do smishing, which is essentially phishing from an SMS or a text perspective. But I think the key to this, both are automated, right? So it runs from an automated perspective. So you talk about we don't have a lot of resources that can help you. But the other one I know that was a real key for you all because you're multi-country, multi-continent
Yeah.
is the localization. So the ability to automatically translate these fish training and all the content into the local language. Maybe you can talk just a minute about that, Patryk.
Yeah, of course. So yeah, we use, if I am correct, 15 languages in the platform, or something like this. Yes, what was one of the most important aspects that we checked when we were choosing the correct tool that we would like to use, was the ability to do as much as possible on automatic way. So I really do not have to, as a manager, I really don't have to spend too much time on let's say overseeing, on managing the my awareness campaign. I have to decide what simulations I would like to be sent during next campaigns. I have to, and do some other things, like decide about the frequency and so on, and that's all. Everything else is automated. So even the translations are automated. So if I don't have a need to change anything in the content, everything that is presented in given language is also in very good quality translated to every single other language that is available on the platform. And it's really nice because it is not like it's let's I would say machine-based translation is also translation with the context. So, for example, when the simulation uses some official names of some bodies and so on, it is not, one-to-one translated to another language, but it is translated from the context. So I really like it. We know how limited the cybersecurity resources are. We know how expensive the cybersecurity resources are.
Yes.
Imagine that you need one one man, cybersecurity guy, only to sit and then decide about your awareness campaigns and to manage the campaigns and so on. Imagine how much you'll need to pay to somebody to take off all of those actions. And for me, it's a good save to use such a platform when, as I said, almost everything is automated, what I really like.
Yeah, I think the automation piece of the CyberReady platform, one, it helps, organizations ensure they get regular training out, right? So I think that that's a key piece because a lot of organizations we talk to, as you said, are understaffed. And because of that being understaffed, they either can't get the training out on a regular basis. So they result to once or twice a year, and they definitely for multinational companies have a really hard time getting it out in the native language of all of their employees. So
Uh,
CyberReady automates all of this for organizations. So I think that's
may-
a critical
May-
piece.
Maybe to give a little bit background, how we did where before we engaged CyberReady. So I remember that to provide only one phishing campaign in our group, we needed like almost 2 months because we needed to have more than 10 translations, to agree with so many people when they are going to send something because we haven't had integrated mail platform on the time being. And so 2 months preparations to have only one phishing campaign. And I am having uh, thousands of phishing campaigns every
Yep.
single day in CyberReady without almost any effort. So
Yep.
that's a key feature.
Yeah. No. And one of the other ones I know I wanted to highlight because I think you all have started using it now are these security awareness bites, if I'm not mistaken. So just kind of
Yeah,
curious
you're right.
as to your thoughts on that piece of it as well.
Uh, I love it. It's absolutely fantastic because and then what is even more important because I can love it. I can say that it is good. But when I receive feedback from my employees, when I receive feedback from my users that Patryk, it's excellent. Patryk, this is something that we needed. Patryk, this is something how the cybersecurity content should look like, then I am more than happy. And this is how I see right now the awareness bites because everything is in a nutshell. I have bullet points. How to protect your laptops. You have to do this and this and this. And very easy question, very easy quiz, just to make sure you understood essential part of the byte that you sent. And what is even maybe not more important, but what is also important, I have statistics, so I have dashboards. I can see how my people interact with bytes, how many people open the bytes, how many people answers the quiz, what is the quiz rates, the rates of the answers, and so on. So I can compare the statistics, the dashboards between my simulations, phishing simulations, and I can really see how my awareness, my training that I send, impact people ability to react when they see phishing simulation.
Yeah. No, and again, I think that hits on some of the key other features that we have here regarding the internal communications or the ability to provide your employees with scorecards. Hey, this is how you're doing. This is how you did. Department managers with scorecards. And when you talked about the security awareness bites, that's one area of focus that CyberReady is going to have next year, is improving those bites and providing more of those bites for you and your employees. So that's really great feedback. I appreciate it. But I think the point to keep in mind is about the CyberReady solution is it's really a platform. And through all those modules that we talked about, it really delivers an overall training program, which has been shown to improve employee engagement with the program and thereby delivering training that's effective, efficient, and really impactful. And I'll hit a slide here real quick. We track a lot of KPIs across CyberReady, but a couple of the big ones that we look at on a regular basis across our customer base is, high risk group reduction. So these are your serial clickers or folks that are at high risk. And the other one is an overall employee resilience score, which really measures the employee's ability to recognize, respond to, and recover from, cyber threats such as phishing attacks or social engineering attacks. To CyberReady, these scores really quantify an employee's effectiveness in protecting themselves and the organization against cyber risk. So I know, Patryk, we don't want to get into a lot of things around Medicover, but I'm sure you all have critical KPIs and the importance of feedback. And I think, as we talk, the CyberReady platform is really designed, and you can configure the different types of reports and feedback that you're getting or receiving, so you can really see how your organization is improving.
Yeah, that's correct, and it's also important for organizations like ours where that are certified on some ISO standards. We have to have some KPIs. We have to prove not only for our board, but we have to prove for external certification institutions that keep the certification for us. And to provide that our information security management system works properly. And we also decided to add some of the KPIs that we use to measure our information security management system based on CyberReady. So we use the click rate score, so the overall score for how many people tend to click on phishing simulations. And what I can also comment when I see these statistics, I can say that it is true. And so if if the organization starts to using advanced tool for providing the phishing simulations for awareness, the first results would be pretty high.
Yeah.
That's how it should that how it is. Because people don't once you start, you can realize how much people don't understand what is phishing, how easily people can be hacked by the hackers. But with every single simulation, with every single campaign, the resilience score is better. So it's and when you can see on the statistics, the statistics clearly show that your with every single campaign your resilience score will be better and better. And I can say that really we reduced number of so-called high risk group of employees by almost 90% comparing to the point of time when we started using CyberReady.
Yeah, that's great feedback. And again, I think as we talked, the ability to be able to track and get that feedback is also critical, for yourself and other organizations to think about.
Yeah.
Um, you know, I know we hit this, but these are the languages that we support out of the box. So I think it's really important to highlight that for organizations. And then, just a quick background on the company itself. We were founded in 2015. As I mentioned, our founders really came at it from a learning perspective initially, more than a cyber perspective, which I think is a big plus to us. Very robust, mature company, very large customer base. We're in 80 countries right now. And as we mentioned, we support 42 different languages. So I think that's what we had here for today. So I want to kind of pause there and Patryk, really thank you for joining, giving us your thoughts and insight. Really, really appreciate that. There is a QR code on the screen. If organizations would like to click on that, they'll be able to connect with us and schedule a webinar or just have some follow-up discussions around this. I'm going to stop sharing my screen because I know we did potentially have some questions here. So I want to see if we've got any questions that popped up. So we do have one here. Patryk says all material content are translated for other languages. So I think we answered that and yes, but Patryk, maybe you've got any other insights you want to provide around the content translation.
Yeah, I can't remember a piece of content when something was not when I was not able to use some, for example, phishing simulation or awareness bytes in any language that is available on the platform. But you have to keep you have to keep to know that if you want to change something, you have to provide your own translation for every single language that you would like to use. But it's not an issue because it's not like you have to adjust every single content. It's more to adjust to your very specific needs and policies that are in your organization.
Mm-hmm. Wonderful. Thanks for that. We've got another one that talks about how does CyberReady from an efficacy perspective differ for healthcare organizations? So I'm assuming, are there things, Patryk, that the platform provides that make it more useful for a healthcare organization potentially?
Uh, what what is first that comes to my mind is the content quality that you can have based on the platform, because as I said, I don't know any healthcare organization that can spend so many resources on providing regular good quality content that is divided by the groups of employees, adjusted to their needs. And here you have something like this. So uh, every single employee is provided with the content based on his or her history in the platform. So based on very individual resilience score. And as I said, the content quality is very, very good. So you don't have to spend many time. So you don't have, even sometimes you don't have to spend any time on adjusting the content. So it's like ready to be used. And I think this is one of the most important things because as I said, I can't imagine a situation when a well-paid physician that has to provide healthcare services, medical services, procedures for lots of patients during a day. And this is the most important thing. This is something that he or her is focused on. I can't imagine a situation that such a doctor is sitting in front of the screen and reading an article where that even 2 minutes are needed to read the article. Here
Yep.
you don't have to care about this because everything is in a nutshell. You have content that checking the contents like 15 seconds, and it's very easy to be understood, and it's enough.
Wonderful. All right, let's see if we have any more questions. Like I say, if not, feel free to click on the link and we can follow up. Do managers or leaders see the progress of their employees or only their own profile? So I would say there's both. As an employee, you get a scorecard. And as a manager, you get a scorecard for your particular group.
Confirm.
Confirmed by an actual user of the system.
Yeah.
Okay. Any other questions?
Maybe one comment on this, because I think that this is one of the things that engage people more. So if regular employee, regular user regularly is provided with its results on the platform, it engage employees more, I believe, because it's like, oh, I have only 2 of 5 stars when it comes to phishing simulation detection. Maybe I can do something more, or maybe I should contact with cybersecurity department, because maybe something is wrong. Maybe I don't understand something, and this is, I believe, one of the things that engage people more.
No, that's great. That's great. Hold on, let's see. Okay. Any other questions? Well, Patryk, I think we've answered them to this point. Again, I want to thank everybody for joining today, and Patryk, I especially want to thank you for taking the time out of your schedule to give us these great insights into the healthcare space. So, again, thanks for joining, and I hope everybody has a wonderful afternoon. Thank
Thank
you.
you very much. Also, thank you very much once more time for the invitation. And it's been a pleasure to talk about something that actually works and that you're happy about.
Yeah. No, that's awesome. Thank you very much. Have a good
Thank you.
afternoon.
Bye bye.
Uh,